Good day and welcome to the Personal Edge Fitness Podcast. My name is Garrett Williamson. I'm president of Personal Edge Fitness. Thank you so much for joining us today. I'm excited to talk about this topic, and I want to introduce my guest, but real quick, tell you how to get in touch with the show. If you have any questions, as usual, about this podcast or any others, or like I've said before, most of our great ideas for our podcast come from our listeners. So if you have any questions about health, fitness, or wellness, or dispelling the myths of, please contact us at area code 251-278-3343. That's 251-278-EDGE. You can also reach out to me at Garrett, Garrett, at personaledgefitness.com. That's also our website and, of course, our Facebook page. Today we're talking about, it's rather timely because it is October. It is Breast Cancer Awareness Month. And like everything in health, it's somehow tied to exercise. And before we get going too much further, I want to introduce you to my guest, Dr. Carolyn McGuigin. Thank you so much for joining us on the show.
All right. Thanks, Garrett, for having me.
I'm glad you're here. And actually, I'm going to tell a story that I didn't tell you that I was going to tell before the beginning of the podcast, and that is how this podcast came about. Carolyn actually contacted me about this, said, Garrett, you do a podcast, and October's Breast Cancer Awareness Month. Why don't you do one on breast cancer awareness? And I said, well, absolutely, that's a great idea, especially since it's tied to exercise, can be tied to exercise. And I thought I was a genius at putting a podcast together because I turned immediately around and said, fantastic, and will you be my guest on the show? And after a lot of pleading, I think, she somewhat reluctantly agreed. No, I'm kidding. She was gracious enough to be on the show, so I appreciate you joining us. Before we get going into the topic, I want to tell you a little bit more about our guest, or have our guest tell us a little more about her. Where are you from? How did you get into this? Give me your story.
All right. Well, I'm originally from Dallas, and I'm in a medical family, so ended up deciding to do surgery. I did my general surgery at UAB, and so up in Birmingham is where I met my husband, Wes, and he's from Mobile. We moved to Boston where I did fellowship. So I did fellowship at the Massachusetts General Hospital and the Brigham and Women's Hospital, which are the Harvard hospitals up in Boston. And then we moved back to Mobile, his hometown.
Thankfully for us.
So we're really happy. We have 2 little boys, a 3-year-old and a 1-year-old, and we're busy and it's good.
Awesome. Fantastic. That's great. So, well, I'm glad that you met Wes for many reasons, but that also because you brought you back here to Mobile. So, you mentioned you come from a medical family. Y'all have heard that a few million times because I say that all the time. But you chose surgery. But you also told me when we were talking before that you kind of wanted to go in this field. Any particular thing that led you here, or just had an interest in surgery, or?
First it was surgery in general.
Right.
I really liked taking care of cancer patients.
Okay.
I learned I really liked taking care of female patients.
All right.
And breast cancer seemed like a good fit. It's, as far as cancer goes, the outcomes are really good.
Good.
And so
good.
It's a good relationship.
Right.
As opposed to a lot of surgical fields, you actually get to follow your patients for a long time. So we're there for the diagnosis and, of course, the surgery, and you help them get to everywhere they need to be and get everything kind of coordinated. And then you get to see them like a year later and 2 years later and 3 years later when life's back to normal and they're doing good. And it's a very rewarding career. Awesome.
That makes perfect sense. Helping people in general, but also that's something I've never thought about the fact that how much in what you do, you actually have a chance to follow the patient along, get to see them through the entire journey. That makes perfect sense. Okay. Before we go on and go way off on a tangent talking personal, because my listeners know I'll do that a lot, let's get to our subject. Breast cancer. Some basic information about that, or basic preventions, what have you. Give us kind of the 411 for the general public on this.
Well, breast cancer unfortunately is very common. So about 1 in 8 women will get breast cancer, or that's about 12% of the population. Wow, okay. So most people will know someone that goes through this or has gone through this. Right. Early detection is key. Okay. So today, between all the research that's really improved screening, detection, and as well as treatments, the outcome are better. Our treatments are better than ever before. So it's really, there's certain, lifestyle things and stuff like that you can do for prevention, but really early detection is key. Okay. So I would say, average risk, women should get should start getting their mammograms at 40. Okay. Getting one every year. And then as breast surgeons, we really advocate that patients get a formal risk assessment.
Okay. What's the breakdown on that?
So, not, the average risk is 12%, right? But some people are going to be lower than that. Some people are going to be higher than that. And a lot of these are factors that maybe you can't control, hormonal factors and things like that. And some of them are family history.
Right.
And so, I know at our institution, when you go to get your first mammogram, they do a formal risk assessment.
Okay.
But if you think you might be high risk, right? Maybe your mom had breast cancer or something like that. We recommend you see a doctor and you get a formal risk assessment. They're easy to do.
Sure.
It's just a couple questions.
Right.
And because for some women who are at higher risk, they might need to get their screening earlier or have, more frequent screenings.
Right. Well, and being a male, and I would. This may sound like a strange question, but as far as having a mammogram done, I mean, your primary care physician can handle that or order that or what have you? Or?
Yep, your PCP or if you see an OB-GYN, they can order it too. Okay. It's simple. You go into the breast center and it takes a few minutes. Right.
Well, and I also bring that up for the guys that are listening here because we, like you said a minute ago, the prevalence of it. I don't know of anybody that hasn't been one way or the other touched by it. I've got it in my family, it'd be really difficult to find somebody that didn't touch by it. But I bring it up for the guys to understand, mainly because encouraging our loved ones to make sure we take those steps of prevention. And hey, we've got our own too, so
right.
It works both ways as far as that goes. So you said average risk and you said high risk. Now, family history has something to do as far as high risk, but anything else that I may be missing?
So family history is the big one. There are certain things, people who are on maybe hormone replacement therapy or if they have dense breasts.
Right.
Those are kind of the big factors. There's kind of rare things like if you've had a history of radiation to your chest and things like that.
Okay.
But really, if your risk is over 20%, your estimated lifetime risk, you're considered high risk.
Okay.
And so those women really should be offered screening MRIs if they want,
right.
Or if that makes sense.
Sure.
And they should be checked more frequently. So instead of a once-a-year exam, getting one every 6 months.
Right.
We have a high-risk clinic. There's lots of high-risk clinics that can help monitor that and make sure you're getting all the screening that you should be getting.
Sure. Okay. And I'm glad to hear that's done also. A lot of that pre-screening is done on the level with the primary care physician or the OBGYN. And I would guess, had I been female, I would have probably heard these questions asked, since I'm over 40 years old.
Yeah.
So,
no, I mean, when you go get your mammogram, they ask you, at least at an infirmary, they ask you all these questions and they will tell you what your estimated risk is. They calculate
for
awesome.
You. Okay. Mm-hmm. Okay. Something I didn't know. I'm glad you shared that. That's great. So okay. I do exercise for a living, obviously, and it's and I appreciate you contacting me and telling me, hey, look, there's a link there, and I actually looked up some of this. There's some studies at Colorado State University did one talking about exercise or people staying fit and avoiding breast cancer, and something that I talk about a lot. That you guys heard me tell this on the show several times, and I've talked about. You've heard me talk about it in the live food. You've heard me talk about it in the live age, and that is the top 10 killers in the world. And the number one risk factor for 4 of the top 10 killers happens to be obesity. Well, obesity is number 9 for breast cancer. But you and I were talking about before we started recording about this and getting to my question that I loved your thought process on this. Because you're like, well, that's number 9, but they're kind of all tied. Right. And so there's talk about the relationship, if you would, in general about exercise and breast cancer, either prevention, treatment, whatever.
So from prevention standpoint, I kind of mentioned that there's some lifestyle factors. And
right.
so exercise goes along with that as well as being a healthy weight. And
sure.
those are linked, right?
Right,
so,
of course.
So exercising can, help prevent weight gain. And it's also a factor in women who've had breast cancer. So the chance of it coming back or dying from breast cancer is decreased by women who exercise and are a healthy weight. So it's all linked.
Right. Okay.
And I think I also mentioned, it's not just these lifestyle factors are good for the, decreasing the chance of breast cancer coming back, but they're good for other health things, right? And I mentioned to you that the number one reason or the number one cause of death in women who've had breast cancer is actually heart disease. And so it's all linked. It not only can help the help improve, lower your chance of dying from breast cancer, but from other causes of death as well.
The smile, if you're watching this on video and you saw me smile when she said that, no, I'm not happy that breast cancer patients die from heart disease, but what I was very glad, I appreciated you mentioning that, because it is, like you said, like when we were talking beforehand about the prevalence of, the obesity being a risk factor, and you're saying how all of it's linked. That's the point I was making. That's why I was so excited to hear that obesity is a cause of so many things and it's so tied together that, breast cancer is just one more in line with it. So I saw something, it's funny, in my research, I saw something that I've seen before in other clients with other conditions, and that dealt with lymphedema. Now, first, Carolyn, you don't know this, but my listeners and my viewers here are so excited that I can use a word that has so many syllables in it. But dealing with exercise being beneficial as far as lymphedema is concerned. Can you speak to that also?
Yeah. So kind of back in the day, they used to really caution women, don't do any exercise on that arm. Don't use that arm. I mean, you can don't carry your purse on that side, like all these things. Right. And actually now the evidence is it's the complete opposite. We actually think the more you exercise that arm, the better. It makes sense, right? You're building kind of collaterals and things like that that can help to decrease lymphedema. But yeah, and I mean, this is part of it too, is, exercise in breast cancer, or women who've had breast cancer, right? It can, decrease that recurrence rate, decrease mortality, the things that really are on the forefront of your mind. If you've had breast cancer, you never want to go through this again. Sure. But it can really help alleviate a lot of potential things that affect your quality of life if you've had breast cancer, lymphedema being a huge one. Right. Fatigue, quality of life, anxiety, symptom control, so helping build stronger bones. I mean, a lot of these patients are on medicines that decrease the estrogen in their body, right? So they're more prone to fractures and osteoporosis and things like that. So exercise helps that. It's really, it's all linked. So.
Well, I'm so glad to hear that. Yet another physician saying, exercise may not actually be the answer. That makes my day. Not for everything, but it makes my day. I'm so appreciate you talking about quality of life, and the things that in dealing with this disease, like many others, exercise helping that. And one of the others that I saw was we talk about this a lot with depression, and obviously you've got somebody that's anxious. I mean, well, for instance, you and I had a conversation about this. One of the most challenging things you see, and I felt really foolish when I asked her this question. I said, "What's the most challenging thing you see in your practice?" And you said, "Well, telling somebody they've got, breast cancer," and that it's like a lot of things. It can be simple if you're away from it, but if it's you, that's got to be extremely terrifying. What are the first steps? How do you brace yourself for handling that rather difficult the difficult situation? I mean, as far as what you're going to tell the first time you talk to the patient, whatever. How do you kind of get ready for that?
So it is hard. I've been on the other side, with a family member who was diagnosed with cancer. I know what that feels like to hear those words. In breast cancer, we really get to follow it up with words of encouragement. Right. Really, that we have really good treatments now. Sure. That breast cancer is very treatable, and that we all kind of work together. So often it does include surgery and radiation and chemotherapy and maybe hormonal therapy and things like that. But it works. Right. And there's another side to it. I always tell cardio patients, I will see you in a year or two when, you're just coming in and getting your mammogram and life's back to normal. And, and actually it's usually at those appointments that we do talk about these kind of continuing the lifestyle things. And, you mentioned depression and anxiety and things like that. I think, not to just harp on exercise, but women really want something that they can take matters into their own hands and something that they can really do. Oh, yeah, okay. And so this is something that, that they can do, right? They can walk or run or something to really to do everything that they can to make sure that this doesn't come back.
I would guess that they've got something that they don't feel like they're in control of. And exercise, among many other things, I'm sure that you tell them, but exercise is one way they can feel like they're having control of this, having some control of this. And there's been I've talked about the Harvard studies, and when we talk about mindset, as far as healing is concerned. When you think, that has a lot to do with thinking I'm going to get better, thinking I'm going to do better, and that would I never thought of it that way, but the fact that exercise would give them something tangible they could work on, they could get control of. What am I leaving out? Is there anything else we need to cover? Especially since, like you said when you contacted me about this is Breast Cancer Awareness Month. What do we want to make sure everybody knows?
I think just the last kind of things I'll say about the exercise is that, really the studies show, yes, there's these guidelines you can meet and how much you should, do every day. But the studies ultimately show that the more you move, the more frequent, the better. That there is a benefit that to not necessarily meeting the guidelines and how much you should be exercising, but that if you are active, you will do better than someone who's inactive. And that it's never too late to start.
Thank you.
They show that women who maybe have never exercised and they're diagnosed with this years ago, that if they start moving, like walking, running, they still have a benefit. It will still decrease their recurrence rates. So.
Yeah, no, that makes perfect sense, definitely. If anybody's got any questions about this or wants to learn more about you, how do they get in touch with you?
So I have clinic and I operate both at Mobile Infirmary and Thomas Hospital. And so our clinics are there, and we have high-risk clinics at both of those locations as well.
Fantastic. And we'll have that information on our Facebook page and also Instagram. Wherever you're seeing this on video, we'll have that information there if you want to click and get some more information on Dr. McGuigin. So, Dr. McGuigin, thank you so much for joining us today. I appreciate you being here for such an incredibly important subject. And also, like I've said many times, that exercise affects everything we do. And I love the fact that we talked about gaining control. Gaining control of having some control in a somewhat out of control situation. Controlling obesity is the key to a lot of it. Like the Dr. McGuigin said, how much obesity is tied to everything we do. If you need help in that area, or you want to get started, you want to sit down and just talk about it, contact us, area code 251-278-3343. That's 251-278-EDGE. You're welcome to reach out to me at my email address, which is garrett@personaledgefitness.com. Hit me up on Twitter at @TeamPE, our website, or our Facebook page. However we can help you, and not only on this particular topic, or any way we can help you increase your level of wellness. Thank you so much for joining us today.